Part 3 in our video, we are looking at poverty and the effects of poverty on academic performance. And this third one, looks at acute and chronic stressors. Acute stress, defining our terms, is severe trauma resulting from extreme incidents, violence, or abuse, which is more prevalent in high poverty environments. Chronic stress is high stress sustained over time. Children living in low SES tend to be subject to more of both. Chronic stress is more common, however, and exerts more of a negative influence. Now, children in poverty experience significantly more chronic stress than their counterparts, their non-poverty counterparts, and this negatively impacts their physical, psychological, emotional, and cognitive functioning and development. So stressor is anything that disrupts homeostasis, and we're going to define that term in just a minute, but it could be anything like criticism, neglect, social exclusion, lack of enrichment, malnutrition, drug use, toxins in the environment, exposure to violence. A stressor triggers this fight or flight mechanism. And again, poverty tends to have more of all these negative things in their environment, this fight or flight mechanism. Now, homeostasis is the body's ability to right itself, to seek equilibrium. You have this extreme physiological reaction, that's the fight or flight mechanism. Remember, emotional is a physiological response to an external condition. Homeostasis is the ability of the brain or the body to bring itself back to normal. Now, it could be a physical back to normal, physical homeostasis, like when you get a virus, all right? To seek disequilibrium, that's the body's ability to heal itself, bring itself back to normal, and psychological homeostasis as well. Extreme stress, extreme depression, extreme manic episodes, and homeostasis, the ability to bring itself back to normal. Now, the body is well adapted to short-term threats to homeostasis. This chronic or acute stressors challenge the body and brain's homeostasis. And these are things such as overcrowded classrooms, substandard housing, unsafe neighborhoods, community or domestic violence. All these things challenge this homeostasis. All these things. Exposure to chronic and acute stress, it becomes hardwired into the developing brain. There's this increase in cortisol, which is the stress hormone, which affects the prefrontal cortex necessary for learning. This is a production of the fight or flight stress hormone, and that atrophies areas of the brain that control emotional regulation, empathy, and social functioning. So we have a physiological stress effect on the brain in response to things going on around us. And here's another term, allostatic wear. Chronic unmediated stress results in allostatic load, this wear and tear. Our brain doesn't return to this healthy baseline as it once did. The growing brain adapts to negative life experiences, becomes hyper-responsive, or hypo, which is low response to things happening in the environment. And here's a picture of stress picked up by the child there. So chronic stress affects school behavior. It is linked to all of these things. Absences, impairs attention and concentration, reduces cognitive creativity and memory. Social skills, judgment, motivation, determination, effort, increases the likelihood of depression. So this idea that everyone in America has an equal opportunity, an equal chance, well, yes and no. Where you come from does matter. Impulsivity can be an exaggerated stress response. It is a survival mechanism. You need these quick movements and decisions in order to survive. You don't have time to think about it. And that is one response, this impulsivity. That is an evolutionary response to a stressful environment. Now, girls exposed to abuse, physical or sexual abuse, tend to experience mood swings. Boys exposed to abuse, physical or sexual, tend to experience impairments in curiosity, learning, and memory. These are just some of the responses. So, what is a school's response? What are some things that can be done? First of all, reduce homework stress. Less homework. Incorporate it more into the class. We don't need another stressor. Provide time in class. And here's the thing, if you're living in an area, if you have children or students, low SES, you can't control the environment at home. You can control the school environment. So more learning does not happen with more homework. It's okay to have less homework, but make sure it's good homework. More cooperative and social interactions within the classroom, less top-down authoritarian kinds of things. Increase student empowerment, more decision making. Doesn't mean total choice all the time, but it means some choice some of the time. Would you rather do this or that? And teach students how to manage stress, emotional coping skills. Teach students how to deal with anger and frustration. We can't expect them to know how to deal with any of these at any level, whether first grade or high school. All right. Teach conflict resolution skills. This is a social skill. This is what you do. Beyond the scope of this one to go into there, but there are a lot of good programs. Model how to solve real world problems. I have this problem. This is what I did. Give students, this is an example of problem solving, though, by the way, problem-based learning. Give students weekly social interpersonal problems to solve collectively or small group. Here's Johnny. Johnny did this. What do you think Johnny should do? Boom. All right. Simple. You get to hear other people's thought process. And the next one, we will be looking at cognitive lags, but this one looked at just some of the issues related to acute and chronic stressors.